The MedLite's long wavelength, short pulse duration, and high peak power combine to optimally destroy dark chromophores with a very low risk of permanent tissue damage. Research conducted by Dr. R. Rox Anderson and Dr. Suzanne Kilmer at the Massachusetts General Hospital showed the 1064 nanometer wavelength to be excellent in the removal of black and dark blue ink, even in darker skin. The longer 1064 nanometer wavelength significantly lowers the risk of hypopigmentation when compared to lasers in 600 to 800 nanometer range, while the short nanosecond pulse duration limits the tissue's exposure to heat buildup, therefore reducing the risk of scarring. When treating a black or dark blue tattoo for the first time, it is suggested to treat with a larger spot size, such as 6 millimeters, at a wavelength of 1064 nanometers. You should hear a snapping sound and a gray-white tissue response should result. To avoid hyper or hypopigmentation on Fitzpatrick 5 and 6 skin types, reduce your normal settings by 50%. Red, purple, and orange tattoo ink is very common in professional tattoos. The 532 nanometer wavelength is ideal for the removal of inks in these colors, which are typically resistant to removal with 600 to 800 nanometer light. Significant red ink removal has been demonstrated with just one treatment of 532 nanometers. Treat the entire tattoo first with 1064 nanometers. Change the setting to 532 nanometers and treat the red, purple, and orange inks to a snow-white tissue response. After the treatment, ice intermittently for 1 to 2 hours. The 585 nanometer wavelength is used to treat sky blue ink, while the 650 nanometer wavelength is used to treat green ink. Setting the MedLite C6 to the MultiLite 650 nanometer setting and switching to the red 650 handpiece, treat the green ink accordingly. Remember to change to the appropriate eyewear. To treat sky blue ink, set the MedLite C6 to the MultiLite 585 nanometer setting and switch to the yellow 585 handpiece and treat the sky blue ink accordingly. Following treatment, dress the treated area with either polysporin, Bactroban, or Aquaphor.